I just want to welcome to our session. Today we're going to talk about, as you can see, the title is From Admission to Welcoming, Transforming the Experience of Moving In. My name is Kit, I'm a dietitian, and my good friend here, Parmjit, she's an OT, and we work in the same community, St. Vincent's Langara. Okay. So I just want you to close your eyes for about a minute. Just imagine, I want to take you through this time tunnel. Imagine yourself at 83 years old, and you were happily, comfortably staying in your home, and unfortunately, one day you have a fall, and you're no longer to go back to your home. And now you have to go to a care home, and it's your first day moving into a care home, and you're accompanied by your son and your daughter-in-law. When you go into that care home, what would you like to see? How would you want to be welcomed? Okay, hold that thought, and then we'll come back to it at the end of the session, okay? So just give you a bit of background of where we come from. Both Parmjit and I work at St. Vincent's Langara. It's one of the 5 residential care homes with Providence Healthcare. And Providence Healthcare is one of the healthcare organizations in serving a very diverse, ethically diverse area in Vancouver, British Columbia, and Canada. And in St. Vincent's Langara, we're home to 197 elders, and over 40% of residents are Chinese. So today I'm just going to go through, we have conducted a study, and we're going to go through the background or the purpose of our study, our research goals, how we did it, the findings, and how we use the finding to develop some strategies for successful transition and also moving in. Okay. So when a new resident moves into our home, we have a team of interdisciplinary team that including nurses, nursing aide, PT, OT, pastoral care, dietitian. When the resident first moves in the first couple of days, we all go in to visit the resident to do the assessment. So we often wonder, with all these people going to see the resident, do they feel overwhelmed? And is this the admission process reflect the Eden philosophy? And also we want to, when we look at the literature, there's really limited research to tell us how the admission process should be done on an Eden basis. So the purpose of our study is to want to explore staff, resident, and family perception of the moving process and how it reflects Eden philosophy and what needs to be improving. And also how the Chinese residents perceive the moving process because of the large population in our community. This one, please. So our goal is to improve the moving process, of course, and we want to determine if there are any cultural differences with the Chinese resident, and we want to have it better aligned with the Eden philosophy. It is a qualitative study. We did focus groups and also interviews. We did focus group with all the staff, including all the professionals, or medical coordinators, or therapists, social workers, nurses, nursing aide, and we have everybody on our staff. And also we do focus group with people working on different shifts, day shift, night shift, weekend, weekday, so we just determine if there's any difference in the perception. We did 10 interviews with the resident families. We did 6 English-speaking and 4 Chinese-speaking, just to reflect the population. We have done the interview within the first, 3rd, or 4th week after they move in to capture the first 2 weeks of experience they have while their memory is still fresh. And also the interview is 1-hour interviews. And for the Chinese resident, we have a professional translator to come in to do the translation for us.
Okay. Hi, so I'm going to discuss some of our findings. Before I go into that, the interviews and the focus groups were all digitally recorded and then later transcribed. And then we analyzed our findings using the Granham and London method of looking for common themes and meaning units. The overall findings, as you see, were two big factors: welcoming and settling in. These we divided into subheadings under welcoming, introduction, and communication. Settling in under with getting to know the resident, transitioning, and building the community. For welcoming, we started with introduction to staff. There is a lot of visitors, meaning staff, in terms of greeting my mum, but they didn't leave me a card or leave my mum a card. So it's just like you're going to a party and you meet a lot of people, and after the first 2 hours, everybody disappears. I would say, as far as the first day goes, if they could pace it out a little bit, they will give us the card, we can find them instead of a family member. Another family quote: whereas it had been total neglect at the hospital, all these people at the care home are here. She was very, very happy about it. Even though she didn't know what was going on, she was elated that all these people are interested. At 102, you'd think nobody cares. Introduction to staff is really important. People want to know who's looking after them. Staff feel that they try to get to know the resident by reading the chart, so that when they go into their room, they're not seen as barging in. I think we initially try to give them a good welcome and introduce them to as many people as we can, just with the way we approach. We go in there and we help welcome them and feel at home. Staff introduce themselves, they introduce them to the room and their roommate and their dining room mates. If we at least have 2 people in the room speaking the same language, that helps a lot. Introducing them to their roommates, I try to make it a habit to go in there and tell them who's in the room. We have some rooms that are private and just 1 bed, others are semi-private with 2 beds, and then we have, majority of the beds are 4plexes, so there's 4 people sharing a room. We make sure they sit in the dining room with somebody compatible. So you can see that people are trying to alleviate some of the loneliness and have them sitting around people that they can converse with. Introduction to the immediate environment comes next. People want to know where they will be sleeping and where their bedroom will be. I love living here. Go to sleep here every night, wake up every morning. I love living here, said a resident. Another family member: even if there is a list of things on your website that we could bring, my mom says there's no pillow. We spent the whole day looking for a pillow. We had to go home and bring a pillow and settle her down. We can all relate to being in a hotel. The pillow is important to us. Personal preferences like this make people feel welcome. Under welcoming, communication is important. What we say and how we say it is really important to people. A family member didn't feel that they were really received very, very warmly. When they came in the front doors, they stood at a front desk. Someone gave them some pamphlets. I didn't really feel welcome, not a warm welcoming experience. Another family didn't receive the resident handbook. A handbook is something that gives a little bit of information about what they can bring with them from home, i.e. a small TV or family pictures. And that family can visit any time of the day in the first few weeks. They can come at night and help their loved one settle in. They didn't know who to contact or phone once their mother was admitted to Langara. The next theme was settling in, getting to know the residents, and Kit's going to take over here.
So with getting to know the resident, the first thing is building trust. So some of our problems come from families that do not trust us, create huge challenges. If they saw the care plan, that will build trust. Another family have some concerns about there has to be some accountability. So I guess that nobody will explain to them who's the organization, who's in charge, and who's accountable for which area. So there has to be some accountability. Who oversee what, who monitor what staff, where is it written down, who check to make sure certain things are done the way they should be. So there's not the trust there to help them to settle. And giving the resident, knowing them what they like is important. The staff, the family feel that the staff tries to involve them in a lot of activities suited to their needs. There are choices around food which alleviate the helplessness part. Residents can make choices, cultural preferences. And staff knows that it's really important to provide opportunities for the family to partner in with care. So inform the family they may visit anytime. They can come and help in the feeding and bring this and that. So families won't be right away detached. They can be involved in the care. They don't want to feel that they've been abandoned. That's important. And also staff really noticing that it's important to acknowledge the loss. It's deep sense of loss and helplessness on the part of the children also. For me, I think it's really important just to acknowledge that it's how they're feeling. And it's natural, it's unpleasant, but it's not uncommon. And the staff, often they said that they can see on their face when they first come in, they're frightened. To build a community, we need to first form the relationship. If they don't have family, we kind of make sure the resident will have clothing. If they don't have money, we will be the one to cut their hair. And then you can also see the family already forming relationship with other families and residents in the first or fourth week. I've talked to some of the resident family members who come in to visit them. They are quite nice. They can have a resident committee that's made of the residents so that when my mom comes, they will come in a wheelchair and say, I have been here so many years and you can do this. I think that would be an idea. So that's one suggestion that we've taken, and then we started establishing resident welcoming ambassadors to do the welcoming. Residents say, I have friends here. Friends are greeting each other and taking care of each other, that sort of stuff. So you see that it's really important for the family and resident that they want the opportunities to provide care and give cares. To no surprises, we want to see the perception of Chinese resident family. They value the same language staff. The nurse who speaks Chinese, she loves talking to him. He likes her. They were joking around sometimes. If there's a Chinese-speaking nurse, he won't lash out. And cultural preferences are important. TV, if they have Chinese TV channel, that will help. Now, before I go on to this slide, I just want to give you a bit of background information about BC healthcare. In the BC, we have first available bed policy that's developed in a few years ago. Because of the high demand of acute care beds in BC, there's never empty bed. So when the patient is ready to be transferred to a care home, they are told they have to be transferred within a day or two. And whether they like it or not, the first bed available in any residential care in the area, they'll be transferred to the care home. So whether they don't know, they may not like the residential care home, but they have to go because they have to free up the bed from acute care. So you can see that it really poses a problem for the resident and the care team of the receiving end. And then once they get to the first available bed care home, then they can put on a waiting list to go to the preferred facility. But that could take up to 1 to 2 years of wait list for them to go there. So now just once you know this background, you know where this information comes from. We weren't looking for this information when we do the research, but it keeps coming up with all the focus groups and also the interviews with families and residents. So there's lack of information provided on residential care. Whether they're coming from acute or from home, they don't have a good picture of what ratio, meaning the staff to residents ratio, because they weren't told about it in acute care. So when they were transferred to residential care, some of the resident families still expecting 1-to-1 ratio, like physiotherapy and so on. The family got a runaround for information prior to admission. No one provided clear direction or information about what their options were, felt lost before coming to residential care. So that put them really in a stressful situation before even they've come in. Acute care discharge planning. If the hospital could have provided a number for us to call to go back so that we can access when we have problem, we can phone them and they can access the file just for follow-up information. And another family say the preparation not adequate, not enough in terms of preparing the family. The person being admitted to here, the hospital gave us the feeling they don't want us, get rid of us. That was really stressful. So can you just imagine that? They were told the morning and they were discharged the next day or the same afternoon. They're in a completely new environment. So that's a very stressful situation for the resident family.
So in conclusion, whereas the team had thought that perhaps we were overwhelming the residents and the families on day of moving, they actually, through the research data, revealed that they value the personal touch and the efforts that are made to help them settle into their new home. They do, however, want the process to be paced out a little bit better. Staff do practice components of Eden, but more awareness is needed too. And no surprise, Chinese residents and families value people who speak their language and offer them cultural choices in the activities that they do day to day. So some strategies for successful transition. We need to pay attention to better preparing the resident and their family for discharge from acute care. In order to do this, we've, the acute care end of things have enhanced information on care home options prior to discharge so that families and residents can look at that. Alongside our research project, we learned later that they were developing a discharge checklist that gives follow-up appointments and any contact numbers that they need. Providence Healthcare is developing a virtual tour on our facility website. And we're hoping to get the resident handbook up on the website also. We're strengthening welcoming rituals so that families really are able to feel that they're welcome to be at Langara. We place a welcome poster at the reception and in the dining room. At the reception, when they first come in, it serves to inform all the staff so that they can all be part of the welcoming right from when they step in the front door. And then in the dining room, later on during the day of admission, a photograph is taken and the photograph's placed on the poster so that the rest of the community is aware that there is a newcomer. They can look for them, they can approach them and welcome them. We provide the Interdisciplinary Team contact information sheet. And we provide an outline of what the next 24 hours will look like for them so that families know who will come in and who will go and what the expectations are. As Kit mentioned earlier, we've developed resident welcome ambassadors. And these, along with some staff, will go and personally welcome the newcomer. And if it happens to be a Chinese-speaking resident, then we'll find someone who's already been here, who's a resident speaking Chinese, along with a Chinese-speaking staff member, and they will do the welcoming. It's busy in nursing homes, and it's hectic sometimes, but we're trying to pay attention to what we've heard through the research project and take time to answer questions. And we deliberately introduce and welcome the newcomer amongst all the community groups that happen during that week and the next week. So when they're attending exercise group or they're attending a calligraphy group, they're welcomed again. This is an example of our welcome poster. So this is placed at the front door. It says who they are and which room they're going to so they can be directed. And later on, a photograph will be attached on it as well. This is a welcome poster that the welcome ambassador will take so that this can be placed at the bedside. And as you can see, for the Chinese person, the Chinese characters are used. Setting the stage for successful moving in, we're enhancing services to address cultural needs. Over the couple of years since this research project primarily took place in 2012, we've added more culturally appropriate activities such as Tai Chi, calligraphy, mental aerobics in Chinese, and improved the dining experience by offering some Asian menu choices. We're improving the written material in different languages and encouraging staff to book interpreter and translation services whenever there's a meeting organized. Okay, next one. Building trust and relationships is cornerstone to having success with this process. We're introducing them to their roommates, as we said earlier, and then later when they're in the dining room so that they sit with a group of people they can converse with. We welcome them in the midst of other groups happening. And we share the care plan with the family and with the residents so that they know what is going to be happening and what's important to them. These are ways that the staff and the interdisciplinary team are helping them deal with sort of boredom and loneliness and helplessness feelings.
Okay, so just back to where your thoughts are. You were imagining that going through this time tunnel, and you've been an 83-year-old. So after hearing what we do, when you go into the care home, would you feel welcomed? And now back to reality. As a caregiver, will you do anything differently when you go back to your care home? Okay, so that will conclude our session. So if there's any question, we have about probably 5 minutes. We'll welcome any question you may have. Yeah. Yes. The welcome poster, just to go back? Okay, sure. Yeah, there you go. Okay.
These slides will be available on the Eden website.
Hi. Mm-hmm. Yeah.
We were receiving some concerns that when they came in the front door, they asked staff where they should go and people didn't know. So that's why it's now at the front door.
Because with our building, there are 3 floors, and so when a new admission come in, that there are staff on each floor may not know who's coming in. So by putting in the front entrance, that everybody is aware of who's coming in with the name. So when they first come in, they're already being addressed like Mrs. Sunflower, welcome. So actually, a lot of residents were quite surprised. Oh, you know my name already? So that was a nice change for us. Thank you.
Bring this to you.
Thank you. I noticed that you had said in one of the gaps that you may have had was really communicating to families of who's in charge. I didn't know if I heard you address if you did anything about that and how you did it. Thanks.
We deal with it on a one-to-one basis. They know in the ID contact information sheet who the clinical nurse leader is, and they can approach them and ask for how things are run on the unit.
Do you have different informal leaders on your floor?
The interdisciplinary team is all informal leaders.
Okay.
Yeah. Any other questions?
My question is, how many how many new people do you welcome into your community a week?
It can really vary. I'll let Kit answer that one.
Well, our turnover rate, actually in the last couple of years, we really seen a trend that is the turnover rate is really fast, a lot faster compared to 5 or 10 years ago, because they're coming in a lot sicker than they used to. So we probably have about like 15 to 20 admissions a month. Yes.
We were wondering how many dementia and Alzheimer's resident elders you have with you.
Predominantly, we're all dementia and Alzheimer's, with a lot of other complex medical conditions as well.
Actually, I can give you a percentage. It's 58% of people have a diagnosis of dementia. the age, we have actually, again, that's the trend has been we kind of see it emergent. We have people getting younger coming in, and we have people who are getting older. So the range, we have the youngest persons probably like low 60 to 107. So again, there's a very difficult for us to meet the needs when you listen even music in the dining room. Like what do you listen? Paul Anka or somebody Bee Gees, since the 60s. So it's hard to kind of meet the needs. So there's the challenges that we are facing and trying to find solution for that now. So we are learning. It's just a journey that we are seeing changes every day, and we're just learning how to meet the needs of different culture, especially the cultural differences and age differences, and the expectations very different too. With the baby boomers, a lot of them are with the children, so the expectation is a lot higher. And whereas when before, the little young old ladies say, "Oh, I don't want to bother you, just don't bother." Whereas the younger children of with the baby boomer being the younger children, they're using more technology, they're enjoying and more involved in the community and so on. And at the same time, expectations higher too, which is good. But with the resources, how we can meet the need with the resources to match the needs. Yeah, that's a challenge for us.
I'll mention a couple of resources. I do have a sheet of what to expect in the next 24 hours if anybody's interested. It will also be on the website. We put together a poster of our research findings. Again, that will be on the website, but I do have a few hard copies. We wrote an article about the project, and it's in the Canadian Nursing Home from December, if anybody's interested in following up. And again, we have some hard copies if someone's interested. Thank you very much.